Good morning, everyone. My name is Susmita Gudla, and my topic is about the social determinants of health and how they affect a person's ability to live with chronic diseases. A quick introduction, I'm a junior at King High School in Tampa, Florida. I'm actively involved in the Mayor's Youth Leadership Council in Tampa. I'm the vice president of my school's Red Cross and Show Choir. I'm a volunteer at the Grace Community Medical Center. I'm a student scholar in the BEST program, and my future plans include to major in public health. So according to the CDC, the social determinants of health are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. These factors, including education, economic stability, and neighborhood, affect people's access and quality of healthcare. They're important because without understanding external factors in a patient's life, we cannot become effective medical care providers. Healthcare should be looked at as not just treating and prescribing, but should be looked at in terms of all obstacles interfering with the patient's lifestyle. The relation to global health. Global health is a concept that ensures people all over the world get the same access to healthcare and practices by eradicating health disparities caused by the social determinants of health. By bridging the gap between all communities, we can work towards health equity on a local, national, and global level. Globally, diseases such as hypertension and diabetes are major chronic illnesses people need to manage. And the research I'm involved in, and we'll go into more detail about, targets A1C and blood pressure as a baseline measurement of a person's overall health. By targeting these issues on a local level, we can spread awareness and work to targeting them on a national and eventually global scale. As I mentioned before, I'm a volunteer at the Grace Community Medical Center, which is a nonprofit walk-in clinic located in a low-income minority community. When I looked around, I saw the effects of social determinants, which included unreliable transportation and no access to fresh foods, which had a firsthand effect on these patients' health. The Florida State Department of Health issued the Grace Community Medical Center a grant to go into low-income minority communities and conduct a study with around 110 participants. These participants did not have primary care providers and did not have acceptable health insurance for a proper quality of healthcare. In our year-long study, we took baseline measurements such as A1C, BMI, blood pressure, and total cholesterol, and also conducted workshops in these areas on healthy eating, reading food labels, and mental well-being. After 3 months, our team, consisting of volunteers and physicians, followed up on our patients and their baseline stats and compared the numbers, which concluded in a decrease in mainly A1C and blood pressure values. Based on these secondary measurements, we made recommendations and tailored the workshops to the baseline and secondary items of concern. We brought in certified diabetic educators, registered dietitians, and medical doctors to work with the participants. Every 3 months for a year, our team would go back out again and take measurements, interacting with the participants and comparing the statistics. The goal of the study was not only to prioritize the patient's well-being and compare their own values with each other, but we were also working to compare the average values of the community we were working in, a low-income community compared to a higher-income community. After the first quarter, the first 3 months, we started to see a decrease in A1C and blood pressure levels. So for example, we had patient X, which started the study with a 5.7 A1C value, and 3 months in after the workshops and recommendations, had a 5.3 A1C value. And then we see that participant Z started the study with the 167/108 blood pressure value, and 3 months in had a 137/113 blood pressure value. Many of these participants said they felt both mentally and physically better after 6 months into the study. The patients carried on what they learned during the workshops and continued to cook differently. The State of Florida Department of Health renewed our grant for the 2022-2023 year to continue the study for another year after we sent them the statistics from the previous year. A very prominent issue I personally saw when working with the participants was a lack of communication between the physician and the patient, and the information was easily misunderstood because the patient was unfamiliar with certain jargon. We are currently in the process of developing a concept that will allow the patient to better understand, track, and communicate their health, and positively change their understanding of how they can address their chronic disease while working with competent and compassionate medical professionals. This way, we can further target the social determinant, education, by ensuring the patient is comfortable and familiar with health and treatment, and greatly reduce miscommunication and the spread of misinformation. To summarize it, medicine should be approached in a holistic perspective. As future medical care providers, we should be able to recognize and acknowledge the social determinants of health. This study targeted the key social determinant of health, education, by the workshops we did during the quarters to further educate the community. We should work towards health equity and not just health equality. I'd like to leave you all with the question, how effective are we as physicians if we do our job by prescribing medication, but fail to understand the personal circumstances of the patient that don't allow specific treatment plans? I'd like to thank the BEST program, the CEO and founder, Dr. Dexter Frederick, and the BEST board of directors for all their help and support. This program encouraged me to pursue my passion of medicine by guiding and teaching me the basics in the field. The BEST program is a nonprofit organization that holistically prepares our youth as the next generation of medical professionals in order to positively change the look of medicine while addressing the health and medical disparities that affect the communities of color. And I'd like to thank the Grace Community Medical Center and the founder, Ms. Grace Glenn. The mission statement, to be compassionate and understanding at all times, and working with and serving others, regardless of ability to pay, by showing love and respect while maintaining their dignity. These are my references. And this is my contact information. I'll put my email in the chat too. Thank you all so much.